Can PTSD, or post-traumatic stress disorder, be used in a VA disability claim for a low back condition? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation you deserve. This video is yet another in my series of videos in which I answer your service connection questions. I get these from military veterans across the country. Now, this is one that I'll admit, as an orthopedic surgeon, if you had asked me before I started working with veterans, I'd have been like, I don't know that this is necessarily the case. But as I started doing research on veterans' behalves, I found this to be possible. The question is this: I want to try to get my lower back service connected, but I have no service treatment records for going to sick call for my back during service. I am service connected for PTSD. Can I argue my back condition as secondary to PTSD? Now, again, just really look quickly, I'll sort of recap the secondary process. If you're going to argue a disability claim for low back pain or a lumbar spine condition as secondary to service-connected PTSD, you have to show a clear causal link between the two under the framework of secondary service connection. Basically, it applies when a new disability is proximally due to or aggravated by an existing service-connected condition. In this case, that primary condition would be the PTSD. The back issue would be the secondary one. And basically, you need evidence that shows that your PTSD, and that could be through mechanisms like chronic stress, muscle tension, hyperarousal, altered pain perception. We'll talk a little bit about that, how those caused or worsened your lumbar spine problem. Now, first of all, your PTSD has to be already service connected. If it isn't, file for that, and then you can do a secondary claim of the lumbar spine condition secondary to the PTSD after the fact. PTSD can be rated anywhere from 0 to 100% based on a variety of symptoms: anxiety, sleep disturbance, hypervigilance, all which indirectly can affect physical health. But this is what I was a little surprised about when I started doing this. There is a fairly abundant amount of research showing an association between PTSD and chronic back pain in military veterans. There was a study of Vietnam-era twins that found that baseline PTSD symptoms had a 60% higher incidence of new chronic back pain over 5 years, independent of genetic risk factors. A huge percentage of veterans have been shown, the ones that are treated for spine pain, are shown to have psychological stress issues, sometimes severe issues, and PTSD, and leading people to think that the psychological effects of PTSD can affect the lower back and the health physically. First, you're going to want to build your case. Medical evidence, basically evidence that you have a lumbar spine condition, x-rays, MRIs, whatever you need to show degenerative disc disease, spinal stenosis, lumbar radiculopathy, things like that. You want medical evidence of the PTSD in the medical records, and basically that coming on and then showing how over time after that you started to develop back pain and some of these other lumbar spine symptoms. Then you're going to need a Nexus letter. This is key. A Nexus letter from a physician or psychologist, orthopedic surgeon, arguing the PTSD and how it could contribute to the lower back. The PTSD-induced stress, sustained muscle tension in the back, poor posture from avoidance behaviors, heightened pain sensitivity, altered stress responses. All of that can amplify or even begin to initiate the degenerative process in the lumbar spine. Maybe supporting documents like medical records showing the progression of your back pain after treatment of PTSD. Doctor's notes suggesting that some of those symptoms may have increased stress on your back. Maybe it's lay statements or buddy statements from friends or family showing how your PTSD made your flare-ups of your back worse. This is an argument of medical causation, and it's medical, but it's almost illegal, showing how one led to the other and that there was nothing more likely than that to have caused the lumbar spine issues. All right, if you're interested in learning more about the disability claims process, I've written an ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Those. Just click the link in the description below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live shows, and definitely check those out. Now, if you're ready to move forward with the Nexus Letter or DBQ or whatever it is for your disability claim, click the link in the description below this video, same link, we'll pick up the ebook, and then below that you can read more about working with me and working with my team. We try to make the process simple, we try to make it quick, and I work really hard to do work to, Nexus letters, DBQs, whatever, to give you the best chance of success in your claim. Thanks for watching. I appreciate it a ton, and I look forward to working with you.